Hi everybody, and welcome to this revision video on the history of mental illness as part of the psychological health and well-being topic for Stage 2 Psychology. Let's get started. So, the history of mental illness is something that we need to look at because it shows us how far we've actually come in our scientific research. And whilst we still have a long way to go, obviously, we can see how mental illness was attempted to be treated and identified a long time ago, and how much we've actually advanced, not only in what we know and what we can objectively prove, but also in how we treat mental illnesses in a far more humane and scientific way. So the treatment of mental illness dates back as early as 1550 BC in ancient Greece and Egypt. And these treatments were mainly lists of combinations of plants and animal matter. So a lot of the treatments for mental health were concoctions and potions of plants and animal products to try and treat the symptoms that were being displayed. Probably comes as no surprise, though, that the evidence suggests from then that there was not enough distinction between a physical and a mental illness, because obviously the science wasn't available back then and the advancements weren't available back then. So physical and mental illness were treated in the same way because it obviously wasn't known at the time that there was a difference between the two. So the middle of the 19th century saw a push for more humane asylums for the mentally ill as psychology advanced. I will say at this point, and I would have said this in class as well, or I will say it in class, that asylums do not exist anymore. They have been outlawed and they no longer exist. However, they did exist several years ago, unfortunately, as characterized by this picture here. So the typical or stereotypical padded cell with a straitjacket. This is outlawed. This is not allowed legally in Australia anymore, and quite rightfully so. Now, by the mid-1940s, electric shock therapy, or electroconvulsive therapy as it's also known, as you can see here, insulin shock therapy as shown here, and lobotomies, shown here, were very common to treat mental illnesses. So this was unfortunately the case for a lot of patients who had psychosis or symptoms of hallucinations and things like that. It wasn't obviously known in terms of what medications they could take because they weren't developed yet. So unfortunately in the 1940s, these were common practice. So lobotomy procedures, as you can see here, it's quite gruesome. Insulin shock therapy, characterized by putting patients in a medicated coma for up to 3 months to basically rewire or wipe the slate clean in terms of their symptoms and their cognitive functioning and thinking. And early electroconvulsive therapy. Now, we've talked about this in class, or we will talk about this in class, in that modern day ECT is actually very, very safe and very effective. It has a very high success rate. But early electroconvulsive therapy was very, very dangerous because it wasn't known the effects that it would have. And it was a lot of trial and error in terms of voltages and getting the right voltage for each individual patient and knowing what the actual side effects would be. So electroconvulsive therapy, as again we would have talked about in class, involves passing very carefully electric currents through the brain. Modern day ECT is done under a general anesthetic, whereas early ECT was not. So again, we've come a long way in the treatment and the administration of ECT. And again, like I said, it's very effective for very severe depression and PTSD by today's standards. But early ECT was quite inhumane. And again, it was a lot of trial and error where a lot of patients were unfortunately killed. So, treatment of mental illness today is far more ethical and based on rigorous scientific research and empirical research. So, apart from modern day ECT, which again is very successful, lobotomies, asylums, and insulin shock therapy no longer exist because they're obviously not necessary and are very, very inhumane, according to the treatments that are far more beneficial, ethical, and scientifically robust that we have today. So I hope you found this video useful. If you have any questions, you know what to do. Let me know.